Happy Thursday, everybody. I hope you're well. It is very early in the morning. I was woken. I had the windows open last night because it was very warm, and I could hear so many birds outside. It's not even funny. They were seagulls and magpies and everything, and very unusual. And then I heard a strange noise in the bedroom. Now I sleep with the cat and dog anyway, so the cat would jump off the bed and on the bed, and then if Teddy gets up, has his drink of water, goes back to his bed. And there was a magpie in my bedroom. God, the chaos. But anyway, and the magpie pooed on my pillow, pooed on my bottom sheet, pooed in two places on the carpet. So, and because he was nervous, it was kind of like diarrhea. So not very nice. But anyway, so that's why I'm up so early. But once I get up, that's it. So, and I'm going to say that was around 5 o'clock this morning. So it's about 6 now, maybe, which is probably not early for some people. But I've been up and I've put the sheets in the wash and I've washed the carpet and all of that. But there was just something I wanted to say, about just, going to the doctor. Okay. So as you all know, or maybe not if you're new, I've got shoulder pain. And the shoulder pain, every time I talk about my shoulder pain, everyone presumes it's because it's after the cancer operation, right? The breast, the lumpectomy, or the lymph nodes being removed or whatever. And it's not to do with that. I've had this for over a year, the shoulder. And then before that, I had 3 years of frozen shoulder, like very bad. And it never went back to complete normal, but pain started again. So I went to my GP, and then my GP referred me to the physio in the clinic where I go. And I don't know if I've said this before, but it was cold. So I think it was March, maybe last March or something. No, it wouldn't have been. It was, anyway, I went around a year ago, and then I had a big jacket on, and I remember I had a scarf, and I went in, and she never even asked me to take off my coat, my scarf. She never asked me to move my arms up, down, in, out, nothing, absolutely nothing. And handed me a sheet and said, do these exercises. And in my head, I thought, how does she know what exercise to do if she doesn't know my movement? Like, she doesn't know if my arm goes fully up, fully down. I just said to her, it's really sore. I did a frozen shoulder. I hope it's not frozen shoulder again coming back, because frozen shoulder starts off as kind of niggly and then gets worse and worse and worse, and it doesn't actually freeze until a certain point. And at that stage, it's really the weirdest thing on the planet. If you haven't had frozen shoulder, it's very, very strange. If you haven't had frozen shoulder, you're very lucky. Frozen shoulder is horrible. I had frozen shoulder in this shoulder, which was normal frozen shoulder, so I could move it a few inches. I couldn't move this one at all. And at the time, my mum had to help me dress and everything. It was unbelievable. It was really, really traumatizing, because it's really painful all the time. No painkillers will remove the pain. That's besides the point. Went about my shoulder. And so she didn't. I was kind of a bit annoyed, and I came back, and I never stopped moving my shoulder and all the rest, but I wasn't sure if I was damaging it. Anyway, between the jigs and the reels, that led to me, because of the pain, and it was shooting, and it went into my breast, and it was shooting, and I just was like that one day, and I went, and there was a lump, right? So the shoulder really saved me. So I'm grateful for my sore shoulder. So the GP had said to me, and when I say GP, I have seen several, so it's not the one GP each time, right? So the GP or AGP in my practice said that they would sort the shoulder out once they sorted this out, the lump. And in fact, they were saying when we do tests and we've realized this isn't cancer, then we'll sort your shoulder. And she actually said, I just don't feed into, you're so anxious, I don't feed into, your anxiety around your health. Fine. I mean, I wasn't that worried, to be honest. So I've had the operation and, all the rest, and I was doing my exercises, but the certain exercises I can't do. And when I went for the CT scan for the radiotherapy, before, you just have a scan before you have your radiotherapy to mark out where they're going to do the radiotherapy. They put my arms back and the pain, but it wasn't even just this shoulder. This shoulder was actually more sore than this one, and this is the bad one. And I was like, oh my God, I'm so stiff, So I went back to the GP and just said, look, I don't want to bother you, but this shoulder is really, I can't function. It's not functionable. If that's even a word, but I can't even reach into cupboards. Do you know what I mean? There's certain cupboards I can't actually use because they're kind of in a corner on the left up. And if I try and use my right arm, you just can't reach. It's just, you can't. So I was like, this is ridiculous. Anyway, went to the GP. And he said, I'll refer you, which I was so grateful to. And they're so nice. The GPs are just lovely where I live. They're absolutely lovely. And I'm blessed. And he said, well, I'll send you to an orthopedic. So I went to the orthopedic surgeon last week. And he said, look, we've done an x-ray. I was sent for an x-ray about a month ago. And he said, look, we've done an x-ray and there's nothing wrong with the bones and, so it's not rotator cuff, it's not this, it's not that. But he said, I don't know. Anyway, he eventually said, I think it's, because I was giving him information and I was saying, like I can lift it, but then I have to hold it up a certain place. I can't lift past a certain point. And I said, it's like there's something it's pulling on. It's actually pulling on something. And I said, but the pain in my shoulder is related to the pain in my breast. So I found a second lump there a couple of weeks ago and I have to get that checked. But the pain in my shoulder was always related to the lump in my breast that I got removed, which was cancer. And then it started for 2 days, terrible pain leading to another area, which was down underneath. And I was going, that's actually now going down there. Jesus. So I touched it and it was another lump. Now, it could be nothing, right? It's probably nothing, I'm hoping. But, I kept saying, and then I always get swollen around here and I'm sore all the way up here. And it's just something that's quite, I suppose, worrying for me. My brother Paul died of lymphoma on his 27th birthday, which is very young. And so I've always had a thing about the lymph nodes, meaning like make sure your lymph nodes are drained, make sure, like I've gone for a lymphatic massage now years ago, and I say, gosh, 12 years ago maybe. But I was always in the gym and swimming, and I know all of that releases, like it kind of keeps everything going. But anyway, so this orthopedic, I said to him, would you think maybe it's my lymph nodes? And I said, because I know that they run down your arm and under your arm and into your chest and up your neck. I said, would you think maybe the frozen shoulder had some sort of impact because like it's blocked? And I said, do you think that kind of blocked maybe my lymph nodes or something like that? Or is there something that's not damaged them, but whatever, maybe are they inflamed, or do you think there could be a little infection or whatever? And he said, yeah, there could be. But this is my point. I'm sorry, I'm a bit all over the place because I've so many thoughts in my head, and I'm finding it very difficult to focus for some reason, and I don't know why. I'm quite tired. I haven't slept, the heat. But he didn't, like, he asked me to move my arm, the orthopedic surgeon, whatever, that was fine. He asked me, but they stand at a distance, and that's fine. But no GP, since I've been here, has ever physically touched me. Ever. Sorry, I take that back. I did go about my lump that I found, and she's the only doctor that I don't like. I went to her and she was very flustered. She was running really, 2 hours behind in her clinic. She's very flustered. God bless her. I'm sure, maybe she was having a bad time. But she told me to sit down. She had her back to me. She was kind of, I don't know, washing her hands, whatever she was doing. I sat on the bed and she said, I don't feel anything. And I said, but it's there. And she said, don't feel anything. And she just turned her back and she sat down. She's writing notes, and I'm left sitting there going, but there's the lump. And she said, I'll refer you somewhere. And she never did. Never did to this day. Never referred me, because I've asked in the hospital, was there a referral? There was no referral made, because it was a couple of months later that the mobile breast clinic came here, and they called me up because I was over 50. That was the only reason I got that call, because I thought I was referred to them, and they said, not at all, no. And there was no referral made. And I did ask when I went to obviously the hospital and everything, was I ever referred to the breast clinic? And they said, no, we've never had a referral. So that's the reason I don't like that doctor. But okay, so she touched me barely, right? But I've never been touched. So when I go and I say I'm sore here under my arm and my shoulder, like, no doctor has said sit down there and felt under my arm. They've never felt under my arm to say, is there, do they feel something that could be swollen? No one's ever checked my neck. No one has ever checked my neck. No one's ever checked me around here. Like, these are things that I would presume are very normal for a doctor to do. You go in, you feel unwell, you're just uncomfortable. You're, like, in my case, I'm constantly hot. And I had a fever after my operation, and it was very high apparently. But I didn't know, because I'm so used to just constantly being hot flushes. But it's not even hot flushes. I think my temperature thing, I'm either freezing when everyone else is warm, or I'm roasting when everyone else is kind of just normal. So I don't have a normal temperature gauge at the moment for some reason, right? But nobody is touching me. Nobody's checking. Nobody's feeling for swollen glands, or I find that very bizarre. And then and I went to the physio. I had to go back to the physio yesterday. Now that was my 3-month, something like 3-month checkup. Come back in 3 months when you've done your exercises. And that's ridiculous. But anyway, I went back 3 months later, and she didn't touch me. Like, I said to her, if I hold my arm, I can lift it up. And I thought she'd come over to me and help my arm up to see how far I could bring it up. Oh, I'm hurting myself now. No touching. No touching. I just find it so bizarre. Very bizarre. Now, I know there's all these new rules and regulations, right? I was in the hospital, and where was I? I was getting, anyway, obviously when with your breasts and that, they do have to touch you with machines and stuff. There's always someone present. But I do remember I asked them when my stitches were, there were stitches kind of still stuck in me. I think they're meant to dissolve and they didn't. And I was quite inflamed and it's left like a scar. But anyway, I said, that's really sore, really, really sore. And my doctor, I think it wasn't the oncologist, I think it was my breast surgeon, said, do would you like me to call somebody into the room while I look at you? I just found it bizarre. And I know there are reasons, there are legal reasons, but I just think things are gone too far. But why aren't doctors touching me? Like, why aren't they checking for swollen glands? Why aren't they, I don't know, checking my temperature? Why aren't they, when I constantly go on about my shoulder killing me and it's shooting down my arm, it's going under here and it's sore, are they not feeling under my arm? Put on a pair of gloves. Even ask, would you like somebody in the room? I don't know. I would never opt for somebody in the room. But yeah, I actually remember years ago in Ireland, in Dublin, in a hospital. I always remember going for like I think it was, anyway, it was something to do with, it wasn't cervical as such, I can't even remember, but it was something obviously kind of down there, right? And I remember this young, beautiful Italian doctor just brought me into the room. He was like a consultant, and he never asked, did I want anyone in the room? Never asked anything. And he just was like checking me. And, he like, what I felt was, it was like the old fashioned way. And I kind of, in one way, was sorry, I keep looking out the window. This movement. There's people, I don't know who they are. Maybe they're milkmen. They're walking around. It's kind of strange. But they literally, now everything's so, you have to, and I get that. But it was kind of like the old fashioned way of like, do you remember doctors would sit and talk to you and say, how are you and how are you feeling? And as they're talking to you, they're doing your blood pressure and they're just doing this and they're saying, open your mouth. And is it a new thing that I'm missing? Is it maybe me? Is it where I am in the world? Is it my particular surgery where I go, or what is it? Like, or is there a new medical thing now that none of that matters? That doesn't, I know they refer you to somebody else, but I was referred to an orthopedic surgeon and he didn't touch me either. He actually didn't touch my shoulder. He didn't even want to see my shoulder. Like, it went straight from, it was my GP had sent me to that hospital for an x-ray of my shoulder. You know, like, I'm going to say 6 weeks ago, a month ago, 6 weeks ago. So that's why they had the x-ray there. And so obviously I didn't see anybody. I just went for the x-ray. But when you go in to see an orthopedic surgeon or a consultant, and you have a sore shoulder, like, if he looked at my shoulder, he might have seen a certain swelling somewhere. He might have seen, I don't know, like it's the posture wasn't correct or something. I was fully clothed, and but it's straight for x-ray, straight for MRI. Like, it's not just even a simple have a look at somebody anymore. Is this me, or am I going crazy? Please let me know. Is it normal? Does this happen to you? Has this happened to you? Does this frustrate you? Do you think this is better? Would you prefer people not touching you? Are you a doctor and you know the actual real reasons for this? Please let me know, because it's something that baffles me. And I'll finish on this. I lived in Paris 25 years ago. And if you went in, At the time, I'm not sure about now, but I remember at the time they were the best country in the world for diagnosing cancer. They were the experts in cancer, and maybe they still are. But and literally they'd know if you had cancer when you'd walk into the room. Literally, apparently, this is what I was told. You'd walk in. I know somebody who did walk into a GP, had been in Ireland for for a full year, sore throats, getting antibiotics, got a job in Paris, went in, and the woman literally just said, "You're going straight to the hospital. You've got." He had lymphoma, but it was the one where the non-Hodgkin's or whatever. And he said if he hadn't gone to Paris for that job, he'd be dead. And he, and a young man in his 20s. For me, anytime I went to a GP in Paris, they checked your breasts instantly. That if you said I have a sore toe, my nail is falling off, I have a sore eye, my hair, anything, it doesn't matter. They did a breast check. That was just for a woman. You got a breast check. They did your glands, the breast. Always, like I remember going, "Oh no, I'm not here." That's what I remember how I found out. I said, "I'm not here for my breasts," and they said, "That's normal. That's just what we do." I think glands and breasts should be checked at every visit. Genuinely, I do. The amount of people with breast cancer is unbelievable. And now that I'm in contact with people, it's not only breast cancer coming at a certain age, it's recurrence of breast cancer. It's shocking. When I found my second lump, my oncologist said, "Call and you'll be seen immediately." And I don't care when it is. And I called, and my oncologist, the cancer nurse said, "Come back in a month. It's probably nothing." She might have reason, I don't know, but it's just a bit daunting, isn't it? Because people who are going to the same hospital as me, because they're the ones that I'm doing workshops with and everything, I've heard stories where they've been told it can't be cancer. It's too soon after your cancer diagnosis. It's too soon after your treatment. And I spoke to a woman on Tuesday, and she had cancer 2 years ago, and she was feeling really unwell. Went to the doctor. Everyone kept just brushing it off. She obviously saying, well, I shouldn't say that, but it was kind of the same medical people as me. And she was being just, for like 3 months, she was just being, ignored basically. And then she ended up in A&E, and they realized her cancer had gone to 3 different, distant organs, which then is, there's no actual cure for that. So I think people should be taken more seriously, basically. Really, I do. I think it's rampant at the moment. What are your thoughts? Have you any experience with this? Please let me know.